Endoscopic submucosal dissection for early esophageal cancer in elderly patients with relative indications for endoscopic treatment. Introduction. During the few past decades, there has been a significant increase in the global incidence of esophageal cancer. In China, esophageal cancer is the third most common cancer and the fourth most fatal cancer. Considering the mortality and morbidity associated with esophagectomy, endoscopic submucosal dissection, ESD, is becoming the preferred treatment for early esophageal squamous cell carcinoma, SCC, including high-grade dysplasia and superficial esophageal cancer. According to the Japanese Esophageal Society, JES guideline, the absolute indication for esophageal ESD is intramucosal cancers involving the epithelium and lamina propria mucosae, whereas the relative indications for ESD encompass cancers that involve the muscularis mucosa, or less than 200 micrometer invasion of the submucosa. In addition, when the risk of lymph node involvement is additional esophagectomy or chemoradiotherapy is more likely to be recommended for patients with relative indications following clinical and histopathological evaluation. The European Society of Gastrointestinal Endoscopy, ESGE, guideline also indicates that further therapy after ESD should be balanced against the risk of lymph node metastasis by a multidisciplinary discussion for lesions involving the muscularis mucosa or less than 200 micrometer invasion of the submucosa without lymphovascular invasion. However, in China, many tumors with relative indications are found in elderly patients, a population that has a higher rate of comorbidities than younger individuals. For this reason, additional treatment options are also somewhat limited for these patients. No studies have been conducted to investigate the prognosis of elderly patients, greater than or equal to 60 years, with relative indications who do not undergo additional treatment after ESD. The aim of this study was to evaluate the long-term outcomes for these patients. This information could be useful in providing a reliable basis for ESD indications and supportive information for the decision about whether to utilize postoperative adjuvant therapy. Background. According to the Japanese Esophageal Society, JES guidelines, early esophageal squamous cell carcinoma, SCC, involving the muscularis mucosae, M3, or upper submucosal, SM1, layers are relative indications for endoscopic submucosal dissection, ESD. Additional esophagectomy or chemoradiotherapy is recommended for patients with relative indications after evaluation. However, elderly patients, greater than or equal to 60 years, with relative indications in China often refuse additional treatment because of the debilitating side effects. The aim of this study was to evaluate the long-term outcomes of elderly patients with relative indications who did not undergo additional treatment after ESD. Methods. Data from elderly patients with relative indications who underwent ESD for early esophageal SCC between January 2008 and December 2013 were reviewed retrospectively. Stricture and recurrence and 5-year progression-free survival, PFS, and overall survival rates were compared with patients with absolute indications for ESD. Results. 158 elderly patients were included and analyzed, 89 in the absolute indications group and 69 in the relative indications group. The baseline characteristics were balanced between the two groups. During 56 months, range 1 to 108, of follow-up, the postoperative stricture rates were similar in the absolute and relative indications groups, 21.3% versus 31.9%, p equals 0.13. The hazard ratio, HR, for PFS in the absolute versus the relative indications groups was 1.025. 95% confidence interval, CI, 0.36 to 2.95, p equals 0.96. The 5-year PFS rates were 90.5%, 95% CI 83.44 to 97.56, and 90.8%, 95% CI 83.74 to 97.86 for the absolute and relative indications groups, respectively. The HR for overall survival in the absolute versus the relative indications groups was 0.564, 95% CI 0.13 to 2.52, p equals 0.45. The 5-year overall survival rates were 96.6%, 95% CI 92.88 to 100, and 95.6%, 95% CI 90.70 to 100 for the absolute and relative indications groups, respectively. Conclusions. Based on this study, regular follow-up without additional treatment may be considered as another choice for elderly patients with early esophageal SCC and relative indications after ESD.